February is American Heart Month. It's an annual national month-long initiative to raise awareness about cardiovascular disease. It is the leading cause of death worldwide. This is a time to promote healthier lifestyles. Throughout the month, people urged to check their blood pressure, manage their cholesterol, also to stop smoking. According to the American Heart Association, someone in the U.S. dies from cardiovascular disease every 34 seconds. That's about 2,500 people in the U.S. who die from cardiovascular disease every day. Almost 47% of U.S. adults have high blood pressure. More than 72% of U.S. adults have unhealthy weight. 57% of U.S. adults have type 2 diabetes or pre-diabetes. Joining us now with more about heart health is Dr. Sorci. He is a cardiologist and the director of the Pulmonary Hypertension Program at Maimonides Health in Brooklyn. Great to have you with us.
Thanks for having me.
Really appreciate some important information. First, let's start with those numbers. When you hear those statistics as a doctor in this field, how does that hit you?
It's striking, and you know, certainly we've made a little bit of headway, but a lot of work to do, as you can see.
Yeah, as a cardiologist at Maimonides, again, serving Brooklyn, what do you see day in and day out in terms of what concerns you among people who come to the hospital when it comes to heart disease?
Yeah, certainly, you know, we want to try to avoid, you know, things like...
In terms of their weight, we're talking about diabetes. These are all conditions.
Yeah, so a lot of times we don't catch these things early and they could be preventable, they could be modifiable.
Yeah.
Diabetes, weight, as you mentioned, certainly, stopping smoking, and high cholesterol. And a lot of those things really don't have a lot of symptoms, and so they can oftentimes go overlooked.
Yeah. And a lot of times it's what, access to care that prevents people from making sure they're maintaining their health, including heart health?
Yeah, certainly for heart health, a lot of times patients either don't have the financial access or even the physical access when they're feeling poorly. And so we try to encourage early screening and access to care as much as possible.
All right, let's talk about some ways to improve your heart health. We'll put those up on the screen and talk over them. First, increase your activity, limit and manage your stress, stop smoking or vaping. Those are big, of course.
Right.
Don't ignore the warning signs. Follow up regularly with your health care provider. Let's talk about first some of those warning signs.
Yeah.
What should you be on the lookout for?
Yeah, certain things like chest pain or exercise intolerance. Maybe you're not able to do as much as you had before. Shortness of breath. Now you're noticing swelling that doesn't go away. Any of those things could certainly prompt some warning signs that you need to see a healthcare provider.
You know, cholesterol is a big one too, right? A lot of it is hereditary, so sometimes no matter how healthy you eat, how much you exercise.
Exactly.
What more should we know about cholesterol?
So that's exactly right. And so I would encourage patients to get screened and follow up with their healthcare provider just because of that reason alone. High cholesterol doesn't really have a symptom per se, so you wouldn't necessarily know it unless you got your labs checked and seen by a provider.
The weight is a big one too, right? Let's talk about that. That seems to be something that, especially an unhealthy weight, obesity, of course, can lead to heart disease.
Yeah, of course. And as you mentioned on those talking points there, certainly increasing activity can help. Managing stress also helps with that, eating a well-balanced diet. And of course, you can't necessarily eliminate all your stress, but it's really how you manage it and find ways to, different outlets to limit the amount of stress that you have.
Yeah, in terms of increasing activity, a lot of people find excuses, oh, we don't have the time. What do you advise what's some of your advice there to those who sometimes struggle with ways to kind of incorporate exercise into their daily routine? It
can be a challenge, certainly, and as you mentioned, we oftentimes pass it off because we're too busy or we don't really have the time. But even little things like if you happen to drive somewhere, you can park a little bit further away. If you are at a building that has multiple floors, instead of taking an elevator, you can increase the activity you do on the stairs, for example. Little things like that are enough to kind of help increase your activities, and small things add up long term.
Talk to us about smoking and vaping. People still smoke today. I mean, obviously the rates have dropped. That is also a factor to heart disease.
It is, and you know, we see an increase in vaping because we think it may be a safer alternative, but you know, really just we don't have a lot of long-term studies to show that it is truly safer, and actually it may be more harmful in some cases because we don't always know the true makeup of some of those chemicals in vaping, you know, compared to cigarettes.
Let's talk about your Maimonides dedicated pulmonary hypertension program there, launched almost a year ago, providing this type of service to southern Brooklyn, an area that did not have this type of program before. Talk to us a little bit about what you do there and the importance of these services to those who may not have access otherwise.
Exactly. And so we did launch our pulmonary hypertension program back in May of 2025, so almost a year ago, as you mentioned. Just like you can have high blood pressure throughout the rest of your body, you can have high blood pressure in the arteries that go from the right side of the heart into the lungs to get oxygenated. And a lot of times what we see with those is that we do need advanced care, and catching that early can certainly help you live longer and with less symptoms. So bringing that to Brooklyn in an underserved area, and especially in a patient population who could be very sick and may not feel like going further out into Manhattan or other areas to get care.
There is a message here, right? Again, access, access, access.
Correct.
We've seen it improved over the years more, I imagine, generally speaking.
Yes.
As a healthcare professional, you would like to see that improve even more?
Yeah, and it's certainly a challenge, right? Because we have a lot of patients in need, and you know, we're certainly limited as programs around the city and around the country. And so anytime a patient can ask for help or see a healthcare provider, then we can certainly encourage them to do that, as well as get them to the place that will best serve them.
Dr. Sorci, it is great to have you with us this morning. We appreciate the
information.
For more information, everything you need to know about heart health, you can head to the American Heart Association's website, heart.org. Doctor, thank you again.
Thank you very much.